So Alice, I know what I think about this because I have quite strong views about this. But do you think, again, from your longevity in the marketplace, do you think that fillers to the public, your average person out there, are a bit controversial?
I think they are, because people are quite confused about fillers. They're not quite sure what they do in the face, but they also have seen a lot of bad work with fillers, and that scares them. So they don't want to go anywhere near it themselves because they fear ending up looking like one of these distorted faces that I've seen in the magazines. Is that what you see?
Yeah, but that's a shame. This is one of my pet, things, because actually I don't think fillers really should be called fillers.
Oh, really?
I think it's almost a misnomer. I think the way we use them now to offer almost like underpinning to the face, like a foundation,
isn't it? Yeah.
Because as you and I know, particularly middle age, it's mainly the structure that alters as we get older.
Because we're losing bone as well as fat, aren't we?
We're losing bone, we're losing fat, we're having gum recession. All these things happen. And it's like, somebody once said to me, it's like the incredible shrinking head. So everything's getting smaller.
And it's all falling in to the middle, isn't it? Yeah.
It's a shame because it's such an easy concept for us to understand that if we actually restore some of that support to the face very skillfully, and it has to be done well, then the face will just look younger, fresher, better immediately. Because if we think of the trending that's going on now in the marketplace with makeup, it's all about contouring. It's all about light and shade. What we're doing now with really clever use of fillers is restoring that often bone loss, but we're creating or restoring to almost generate the look of a younger face where the light reflects off very naturally. And it's a shame because I think a lot of people just think fillers,
when in fact you're giving that internal contouring effect, putting back the structure that the face is losing.
And if I had, when you say, if you had a desert island, what would your one anti-aging thing be?
Apart from sunscreen.
Apart from sunscreen. It would be filler. It would not be muscle relaxant for me. It would not be anything like that. It would be filler. Because that we can keep the face looking really good, well supported and structured. And I think unfortunately, the celebrity world, what a patient will often say is, well, look, if they have all the money and all the access to the best cosmetic doctors, if they can't get it right,
what hope is there for us?
So that's a shame because that's something we often have to keep dispelling those myths and try and get people back into thinking about underpinning, restoring the face.
Because the human eye is very good at telling when something's off with a face, isn't it?
You've only got to throw it off very, very slightly. I say this again to patients, when you look across the room at a party or at a do, you just look across the room. No matter the age of the patient, generally speaking, you can age most women particularly. You can pretty much age them. But that's to do with light reflection and contouring. So I think the main thing with fillers for me is that to try and dispel those myths with patients and actually educate people by showing them now the kind of results we can get with the befores and afters. Because when we can show people, and I do this a lot in clinic, say, what do you think of this woman before? And then I'll show them a photograph of them after treatment. And I'll say, what does that look like to you? Well, they don't look any different, but they look better. And I said, well, that's because they've had X amount of filler. Can you see where the filler's been? And they'll say, no, I can't see where the filler's been. And so that's really interesting.